Welcome to the Women's Health Uncovered podcast. I'm your host, Mariam Harutunyan, and in this podcast, I sit together with doctors, policymakers, industry leaders, and change makers to bring you conversations that matter about women's health, so you can learn more about the topic and why it impacts all of us. I also want to thank FTI Consulting for believing in our mission and making this podcast a reality. In this episode, we sit together with two guests that have unique insights from EU policymaking, international case studies, and gender equality strategies. Welcome, ladies.
Thank you, Mariam.
Allow me to introduce you, Valeria Fagone. You're Managing Director at FTI Consulting Brussels with a passion for healthcare. Welcome.
Thank you. Pleased to be here.
I have a quick question for you, and I just need one word from you. If you could describe what's most missing in EU women's health in one word, what would it be?
Policy action.
Policy action. I would like to explain that, but we will dive into it in the whole podcast. So in a bit, our second guest, all the way from Milan here to join this podcast is Irene Gianotto, healthcare consultant at the European House Ambrosetti. Welcome.
Thank you.
One question for you as well. If your work had a mission tagline in one word, what would it be?
Make a better world in a better way.
Better world. I think better is the tagline, the key word, making things better. Yeah. Thank you very much. Now we are going to connect the dots, as I mentioned, policy, data, gender bias. There's going to be a lot of talks around policy and frameworks, EU countries that are doing it better, worse, etc. Now, if I'm just a regular individual listening to this podcast, I'm not a policymaker. Why should I continue listening to this episode about the frameworks and whatever is happening in the world of policy? Please convince me.
I can give it a go, Mariam. I'd like to be treated as anyone else when I go to a doctor or a hospital, have the same access as men, but also make sure that the healthcare professionals I'm seeing are aware that I could have, for instance, different symptoms than men on any disease and therefore be diagnosed in time. And this is still not entirely happening. So I think policies are relevant to ensure that.
Yeah, you're absolutely right. Do you have anything to add to that?
Yeah, I would add, I think it's more general that policies and laws do exist because of people and citizens. So if we need them, there is a reason why we need to use them and gain some rights from those policies and laws.
Yeah, definitely. We need to know what's out there, what exists, what we can be vocal about, what's being implemented. At the end of the day, it's about us. So we should be informed about that part as well. Well, in the world of healthcare, women's health, we know that there are some misalignments and gaps. Women are diagnosed later than men for over 700 conditions, including several forms of cancer, but it goes broader than that. And less than 2% of global healthcare R&D is dedicated to female-specific conditions. We can already hear what's wrong. So it's also not just about the data, but about the systemic design, the choices that include half the population that we're talking about. So there need to be a lot changed. Now, gender equality includes also many facets, right? Health is one of them. But how do we see all of these inequalities translated into policy? Can you elaborate on that, Valeria?
Absolutely, Mariam. You mentioned that the gap is huge. That 700 disease is actually a huge number that is quite striking, and that I hope is waking up policymakers to and spurring them to act on this issue. There are inequalities that, of course, are led indeed by this gender gap that concern research. You mentioned, less than 2% of representation is huge. The inclusion in clinical trials is very limited, especially in certain diseases. But also data. Little data is gathered about women diseases and women-specific issues and the real experiences of women actually as patients. But also access to care. There are still a lot of inequalities in that. Also power relationships still play a role in the access to healthcare professionals, for instance, or the role that women feel they have in that respect. And also education. Education certainly is not the same for all the women, and we know that it plays a crucial role. While there are certain policies there to ensure these gaps get addressed, that's certainly not enough yet. So more needs to be done.
There's still work to be done. And we have a full episode dedicated on the gender data gap, by the way. So if people want to dive into that, there is an episode where we try to tackle that difficult subject as well. We talked about, which policies are lacking, Valeria, but are there any initiatives on the global level that are being implemented to change that?
There are certainly some initiatives. The WHO, the World Health Organization, has already, since many years, looked at issues related to women's health and has created a number of initiatives, I should say mostly addressing recommendations to countries, of course, who should then implement them. And they concern particular programs related to maternal health or to genital mutilations, especially in some countries, or issues related to domestic violence, for instance, and the impacts, of course, of the relationship with health. So there are limited efforts. There is no true global coordination of these initiatives, especially with teeth, with impact. And that's why we think, at least in Europe, we should have better policies and more enforcement of the existing regulations. A recent meeting of the World Health Assembly has held some discussions about women's health specific challenges. But again, they focus particularly on a very important point, which is ensuring universal health access for all, coverage for all women. But they're still, let's say, very high level and not impactful enough.
But is it policies only, Irene, or are there other dimensions we need to take into consideration when tackling this challenge?
I would say policies do play a key role. As Valeria was saying, they are probably one of the most powerful and impactful instruments that we have, especially at national level. I think we will talk about that in the next minutes, but also regarding the international approach that could actually give some guidelines and create more coherence, more harmonization about the different countries, and also protect all the rights. So arriving all those specific areas and fields where we have more vulnerability and more risks, especially for women, but not only. We don't have to forget that policies are not the only one solution, especially if we need to work on what are more social and cultural dimensions. So, of course, we need to go on, and probably the road is a little bit steeper, and also we see the progress, but it's more delayed, I would say. It takes more time, and also backlashes are easier to get if we need to work on education, so on fighting some stereotypes, on biases, and keep working on that. At the same time, I would say that if we need to put health and women's health at the center of all the different policies, we don't have to forget that also the economic side do play a role, the employment side, in a more, let's say, focused way. And also when we are talking about the social dimension, so the role of the community and how actually the women do play a specific role, not only in the familiar, let's say, dimension, but also inside the specific community. So probably there is more that we need to remember when we talk about women's health. Policies do play a key role, but
definitely.
They are part of the story.
Yeah, there are more elements that we should not forget to take into consideration. And what can we do to better connect the dots between health equity and EU priorities like productivity, competitiveness, and innovation? What I'm interested to hear is what are the missed opportunities as well if we would invest in women's health? Yeah,
probably one of the biggest missed opportunities, I would say, is research. When we talk about women's health, and we analyzed through the analysis that the European House Ambrosetti did, what we discovered, and actually that was not a surprise, we have a very high level of investment in specific pathologies, which are important, and they are increasing in the next future. I'm talking about diabetes, for example, or all the cardiovascular world, that is, of course, relevant. But then if we compare what is the burden of pathology on women and the value of the investment, we have very different ratios. So there is a lot of heterogeneity between what is the investment on specific pathologies and on the ones that are more prevalent or that do have a different impact on women. So one clear step that we have to focus on is that we also have to reframe not only the value of the investments, but also the goals of those investments. Especially when we talk about women's health, we need to remember that the key and probably the highest burden comes from the pathologies that impact the quality of life, even more than the quantity of life. So the actual number of days women are living. We all know about the women paradox that we have. So women are living longer, but in worsened condition compared to men. So we have to rephrase a little bit and rethink about the model of investment that we want to use and the goals of those investments.
What are the blind spots that the EU has that are holding them back from scaling more inclusive models, you'd say?
I would say that we have a problem of harmonization between the different countries and also probably the different stakeholders who are working in that dimension. So even if we look at the burden of the pathologies, and in one of the reports that we elaborated, it's crystal clear, especially I take the example of Italy, but for Europe is the same. 10 pathologies are responsible for half of the burden of bad health for women. But still, those pathologies are not so covered and not so paid attention to from policymakers, but of course also from company sides. We still have many different challenges. Before Valeria was mentioning also research. I'm thinking about the participation of women in clinical trials. And we know that we have many obstacles that are both from a social point of view, the availability of women and the possibility for them to participate. But also we have other issues, for example, regarding the ethical side, especially when we are talking about fertility and maternity of women who are participating. So again, this is a multifaceted issue and we need to consider it like overall.
It is complex, but maybe we can drive some inspiration from elsewhere. What can we learn from other regions? What are they doing better on prevention, community-driven approaches? Anything that can make it easier to or learn from that we can implement here in the EU? Actually,
looking around the globe, like we examined other cases coming from outside Europe, and we've seen that in countries such as Cuba or Costa Rica or, for example, China, Taiwan, Sri Lanka, even if there are in many cases countries with a lower income level compared to the EU countries, or at least most of them, they do have a better level of women's health. Why? We try to understand better what was the common factor among those countries. And what we discover is that actually there is a common base, a common approach more dedicated to prevention rather than treatment. And this is actually something that we have in our models, like in the European models, is more like reactive rather than proactive approach.
Oh yeah, that comes up in every episode where it's like if there is a problem or a disease that we can solve, that's where we can see it, that's where the money goes, that's where the money is. But when we're talking about prevention, that's kind of where we drop the ball and where we miss out a lot.
Yeah.
To follow up on that, what we can learn from others, and also if we zoom into the EU and look at the member states, Valeria, even with its limited legal power, what can the EU realistically do to guide the member states toward more inclusive frameworks?
It can do a lot. As you know, the EU has limited competence on healthcare policy and how healthcare is managed, which remains indeed a responsibility of the member states. But the EU can give a lot of direction in terms of setting common guidelines, in terms of setting recommendations for specific programs for early diagnosis, invest a lot and help member states invest and develop programs on prevention. This is now now a key focus for this current EU mandate. And I think that the best example of the impact of the EU on healthcare policy is certainly the one of cancer. Since 20, even 30 years ago, the EU has been active, has created platforms for the development of standards on quality care, has actually spurred the adoption of council recommendations on screening. And this is why today we women have actually access to mammographies for breast cancer prevention or early identification, or tests for colorectal cancer, or smear tests for ovarian cancers. So these are concrete changes that have been created thanks to the input and the activity that Brussels or the EU institutions have taken in agreement, of course, with the member states. It plays also a key role in making sure that then the member states are actually putting in place these measures, are adopting national plans which are in line with these EU guidelines. And I believe that a better effort, I think, can be made, creating strong, efficient monitoring systems for that ensure more equality also across countries in the EU, but even within the same countries. Examples of women health initiative, or women health related initiative, I shall say, as we don't have yet a dedicated strategy at the European level, is certainly initiatives like the report that the Service of the European Commission dedicated to research and development has issued since a couple of years, which is called the She Figures.
Yes.
Which actually looks interestingly not only at the role of women in research in the sense of the glass ceiling in the field of research or in academia, but actually looking indeed at what we were saying earlier about what is the percentage of research dedicated to women diseases, to women health in general. It also finds that even the EU funding for research for women health is extremely limited. It seems that 1.7% of the Horizon 2020, that is the framework program of research of the EU, was actually dedicated to women-related issues. So there is indeed a big gap. But there have been recently other initiatives, so there is progress. The EU adopted, for instance, a gender equality strategy 2020-2025, so ending this year, in fact, which looks also at existing legislation or reviewing legislations, for instance, as regard equal pay. A very important issue concerning inequalities that also impacts health, by the way. As well as a European care strategy, which looks also at women in the role of carers, as Irene was referring to earlier, the broader roles that women play in society and in the economy. But particularly, I'd like to mention a more recent one, which was adopted in March of this year, which is a roadmap of the European Commission on women's rights.
What's the goal there?
It is a framework initiative. It is still very high level to be designed with specific measures. And it tackles also a broader scope than health, because it really highlights the needs regarding inequality at work, work-life balance, aspects related to employment, to money indeed, but also health or violence as well, as you mentioned. And within that, we hope that the health strand will be further developed in the next years. It's not clear yet, but there is a lot of pressure on the Commission recently to really come up with something more
there
concrete.
Is a momentum. At least there is a step that's being taken into the right direction,
Indeed.
let's say. Let's hope to see what that will bring further. And Valeria, I would like to stay with you, because we're talking about these EU frameworks and what's happening in EU, how we can connect to different member states. But if we zoom in into those member states and look at what's being done on a national level, for example, like, are there any interesting best cases, implementations that one another can learn from each other? Like, I think about Spain that passed the menstrual leave legislation, or France that now provides free menstrual cups to young women. These are real, tangible moves that can or have an impact on our daily lives that women should know about. Are there any national policies that stand out to you as models of good practice?
Yes, a couple of examples that I think should actually be better spread as best practices and maybe scaled up or, spread around the other countries. Certainly the first that come to my mind is a recent one in Ireland where a new action plan has been put in place on women health that actually integrates women health in educational programs for healthcare professionals. And I think that this really tackles the problem at the basis, at the start. So I think it's particularly interesting. And we will see the impacts, of course, in the next years of that. But also others like, for instance, in Scotland, which was the first country, probably worldwide, not even in Europe, to actually provide free menstrual products, for instance, to women, to young girls. So these are, things that can definitely help go in the right direction if tackled maybe in a more coordinated way.
I always love it to see when there are some companies who actually do that, that when you would enter the bathroom and there are free menstrual products and you're like, oh, they heard us or they listen and they see it as a basic right to provide that. It really gives a signal as well to do that on a company organizational level. So it's really nice to see that. Looking at Southern Europe a little bit more, especially Italy or Spain, they have played a visible role in also pushing gender-sensitive health forward. What unique perspectives or momentum comes from this region? What do you see happening there, Irene?
Yeah, I would say something is going on as well, both in Italy and both in Spain. Spain, we know, is a country that has been particularly, I would say, protective and active in terms of women's health and women's rights in general. So you mentioned before the menstrual leave, which is actually something really interesting. Also, it was the first country, Spain, in Europe who decided to move on that way and to make it a law. Still, we don't have to forget that in other countries, if we move around outside Europe, if we look at Zambia, for example, or Japan, maybe nobody knows that they already have something similar. They do have a law for menstrual leave. So the same way, we try to learn from the other countries that we have closer, but in some cases we can also, as we were saying before,
look a bit further,
and maybe we will find something interesting as well. And actually, I don't want to be too pessimistic, but still, we need to remember that, for example, in Spain, they do have this specific leave, but if we look at the data coming from last year, so how many women do actually use those leaves, the perspective is not so good. That's
why is that?
The problem is, I would say, twofold. We have one problem in terms of accessibility. So we do know that for women to access that kind of leave, they need to go to a doctor and to have a specific diagnosis for what they have. Mm-hmm. And it's not so easy, especially if we link to what Valeria was saying before, if we don't have the right education to the healthcare professional. That would be one point. And then we have the reason, which is the fear of discrimination. Mm-hmm. So especially for women when they are already, I would say, facing a lot of challenges from many different aspects in terms of career, in terms of perception, in terms of the management of power, as you were saying before, probably adding on other elements and say, okay, I need more attention, or I am vulnerable because of that, could be another challenge. Mm-hmm. So probably this is not the solution, but still we have to work, as we were saying before, on different levels. So just to give you a number, we know that in Spain we have 10 million of women who are workers in the workforce, and we know that in 1 year only 1,600 of women did ask for the leave. So probably.
So it's societal as well, as I hear you say. You can put so many laws and force new legislations or things to be implemented, but it's still very much societal. Yeah. And that's the dimensions you were mentioning as well. You know, one of them is policy, but it's also as much society. I read that also, you know, when it comes to paternity leave, even if it's limited, a lot of men are not even taking that because of the social stigma, because of the discrimination on the workforce, because of lack of future perspective. If you would do that. So even putting it in place is still not enough. We have to encourage people and change that mindset in society. Yeah. there are different, well, actually, maybe before I dive into my next question, I have a question for both of you related to, we're talking about all these examples. There are some that I feel like, oh, I would love for that to be implemented across the EU, or that in my country. That sounds very interesting. Is there one of those examples that you feel like it should be really adapted across EU countries? That's very personal, but there are so many things, yet one that speaks to you the most.
I would say that the integration of women health-specific curricula or specific courses within the overall healthcare professionals' education, I think, is fundamental. So, for instance, this Irish example I just mentioned would probably be one I would definitely recommend, and that the EU could also actually spur through, policy on education, for instance, or guidelines or recommendations. So I think that's something that could be feasible.
Yeah, that sounds really interesting. If we could make sure that at least, at the root you mentioned, well, it's education early on, but at least that it's implemented in different levels. What would that be for you, Irene?
I would add something coming from Italy, since we mentioned Italy before. I think it's something interesting because I'm passionate about economics and employment. So one of the most interesting cases I would say that I studied looking at those topics regards the financial toxicity of some of the pathologies that we have. Cancer, for example, is one of them. So you do have an important impact in terms of finances, both for the patient herself or himself, but also for the family and for the other expenses that you have and maybe that you cannot forecast. So, for example, if I am a mother, I need to take care of my children, or I cannot go to work, or whatever, I need to buy myself different types of clothes, of makeup, whatever. So you do have these kind of issues. And in Italy, we have a specific solution. It's a kind of a microcredit solution for women that do have cancer, or that do have these kind of issues with in terms of economic challenges when they are ill. And it's both a stimulant for them, of course, to recover and to have all the resources that they need, especially if they are not financially independent. And we know that in Italy, as in many other countries, this is still a problem. But also it's useful for them when they are entrepreneurs. So that could be both, let's say, a benefit on one side, but also kind of recognition of the value that that person can bring to the economy. So not only for herself to be fully realized, but also what she's doing, kind of support on going on what she's doing, also benefiting the other people who are around her. So I think that's interesting.
Very much so. And Mariam, think also at the EU level, for instance, so the importance of a policy directive that was adopted, I believe, last year on consumer credit, which included the principle of the right to be forgotten for cancer patients, for instance. That allows men and women to be able to go back to their jobs, to have insurance, to be able to adopt children, to have access to finance and mortgage, things which become impossible otherwise. So these are really key measures that we need, and that should impact women, of course, particularly.
It sounds hopeful. So fingers crossed that we can have that adapted across different countries so everyone can benefit from their basic rights. What I'm curious about is how these countries, if we can put them in relation to one another. I don't know if there is some kind of a ranking that we can see who's doing better. Is there a scale that we can actually measure it? Because if I'm not mistaken, I believe that the Women's Empowerment Observatory keeps an eye on that.
Yeah, exactly. And so if I can just spend a few words to explain what is the observatory.
Please do.
In 2021, as you probably may remember, that was the first year in which the G20 dedicated a specific conference on women's empowerment. That was a very significant moment. Actually, with the European House Ambrosetti, we supported the Italian presidency at the time, and we created a kind of advisory board to collect not only from policymakers but also for companies, so private companies and actors, what could be the key priorities for the next 5 years to focus on, and also how they can interact both private and public sectors to help reaching these goals. And after that, there was the creation of the observatory. So the idea was to have one, one identity, one platform to control and to monitor and track the progress of all the different G20 countries, plus Spain, which is the member host of the G20.
And then you decided to continue doing that as well.
Exactly.
It was not a one-time thing.
Exactly. So every year we do update and upgrade. We try to upgrade it as well. A specific index, which is called the Women Empowerment Progress Index. And we look around all the different countries, not only the state of the art, so what are the directions that they are actually taking and following, but also what are the key policies that they are acting and also how they are performing. And if I can say...
do we know who's best in class?
Yeah, actually we know. So last year UK was the best country in the ranking. And the first time that France was second, because actually France was the first in the ranking in the previous 2 editions. Yeah. But we have many different countries. For example, Australia as well is one of the countries that we keep an eye on because it's quite active and proposing it. Also, we do have a specific attention to the tail of the ranking, because we do see that many countries are improving very fast. They don't have a very good starting point, like India, Indonesia, but also Saudi Arabia, for example. But they are working a lot. So probably if I have to say who's the fastest moving, are those ones rather than top class.
Well, what brings you to top class? What are they measured on?
On many different dimensions. So one of them is closely linked to women's health, which is the quality of life. So that is how many often, that is the case, women are exposed to violence. How many laws the country has to protect or in favor of women. But then we also consider the economic side. So what is the type of job employment that they have? We know about involuntary employment, part-time employment. So that is one of the indicators that we analyze. We also consider what is the access to different type of resources. So access to education, access to financial resources, but also to other elements like the management. For example, having a bank account is one of the key topics that we analyze in that specific pillar of the index.
Any key findings that you can share with us? Let's say I was going to read the full paper, but if there are any key findings that listeners can take away from that.
Yeah, I would say that from overall perspective, what we observe from the observatory is that we have a very slow pace compared to what we should have in order to have not only all the countries on the same point.
Just moving slow.
But also to reach the optimal level. And do consider that in the index we always compare women on women, so we are not comparing women on men. That is not really the focus. We want to express and to analyze the realization of the full potential of women.
Yes.
And then on the second part, thinking about the policies, we do see that employment is the key step for all that comes after. I mean, if women do have access to good quality jobs, first of all, if they can maintain those jobs, second point, and they can proceed in those jobs with good careers, that is a very, very starting point for everything else. I mean, for quality of life, for the quality of life of the family, for the access to other type of resources.
Yeah. I hear you say it's going, it's going a direction, but it's going a bit slow. And then I'm thinking, what if they would all work together? Or what if there would be some partnerships or stakeholder engagement to make these insights actionable? Isn't that possible, Valeria?
It could be possible if indeed there is collaboration across countries in the development of a women health strategy, European level, but hopefully, more at a global one. Why not? There are premises for that. At the global level, for instance, the initiative of the World Economic Forum as a great platform to build on. And at the EU level, as I mentioned earlier, Mariam, there is indeed now a lot of momentum that is created by the inputs that the healthcare community is providing, that public health, women organizations are actually creating in terms of a demand for a coordinated, comprehensive strategy by the EU institutions. For instance, the European Women Health Institute, which is an NGO that comprises a number of groups in the healthcare community, issued a manifesto last year on the occasion of the European elections, where they really highlighted a number of very concrete recommendations for the EU to adopt within the context of this strategy, and many other organizations have followed. This has led to the creation of a European Parliament group on women health with very active members of Parliament, which are promoting now activity in this field, and hopefully, indeed, will now draft a report of the European Parliament on women health that will actually summarize somehow the political direction or the request that the Parliament will make to the European Commission for the adoption of a women health strategy, and in which actually stakeholders now have the opportunity to contribute to.
What's the goal of the group? What's the direction to take?
It is indeed to make sure that the EU adopt measures which ensure better investments in women health research, that women are better reflected in clinical trials. The clinical trials regulations are also properly implemented, that the pay gap legislation is actually properly implemented. The same, to make sure that member states adopt policies for equal access to care, and so on. So it is a complex of measures that they want to promote, and they're going to do that now through the adoption of this report, which has been announced recently. So
what would you like to see them realize?
Really, I think my hope is that indeed this gets picked up by the European Commission, and that we can see a strategy being developed as it has happened on rights for women more broadly, but with a very strong focus on women health. So I think that the momentum is now, as I was saying, stakeholders have now the opportunity to engage. And my recommendation would be really, but if you're either an individual, an organization, a company, really do engage with the healthcare organizations, with the NGOs which are active, get informed, maybe talk to your members of parliament to really activate champions, and also really promote these activities, because there is a great need. And I think that there's now a lot of attention to this topic, and I'm hopeful that this will materialize.
Thankfully so, that there is some attention going to it now, but indeed there is some momentum building up, and there are some elements that are put into place. Let's hope that they can find their way each other, that there is some alignment to see actual progress. And something not to forget that is also important in this story, and probably that's why we dedicated a full episode on that, on the economic impact of women's health and healthcare, or inclusive healthcare. Health inequalities cost the EU nearly 1 trillion annually, and gender equality could raise EU GDP by 6 to 10%, up to 2.3 trillion. So we're talking about huge numbers that we could actually achieve, or reduce or achieve on the positive side if we would do something. But are we doing enough? Valeria, are we doing enough to make the economic case for gender equality in healthcare?
Well, apparently not enough, because we haven't seen these policies yet, I would say. But what I'm glad to see is that indeed there is more and more data. You recently interviewed the OECD, for instance. Mariam had a great discussion where they've had the chance indeed to highlight some of the amazing figures. So you mentioned some of them. The point is, how do we use them? So this is really important, and I think that we need to involve in this discussion, keep talking about this theme, and also reach to additional audiences, because maybe so far we have thought of involving or engaging in a dialogue with the health stakeholders only, but this is a multifaceted issue. We've looked at this. There are multiple aspects that need to be looked at, the social aspects, the cultural aspects, the health aspects, and we need to reach out to those in charge of the finances. So we need to look at investments. Health needs to be seen indeed as an investment, not as a cost. We say that for health in general, but particularly here where we see a huge loss of productivity and a huge impact on the economy. So maybe I think that the dialogue needs to be elevated to ministers of finance, to, those who manage the funding at EU level as well, because that's a very important argument. Really having an evidence-based discussion will certainly help.
Yeah. Are there other elements, Irene, that you think of that we should not forget in this conversation about the economic case of healthcare?
Yeah, probably one that we mentioned at the beginning, but maybe we can underline even now, that is gender-based violence, which actually do have an enormous impact both on the physical, mental, emotional well-being of women. And of course, it has an impact in terms of economics, both in the direct costs that it brings, but also in the indirect ones. So if we consider the EU perimeter, we know that it's more than 360 billion of euro each year, the cost of gender-based violence. And if we look at the only part dedicated, I would say the women, the violence against women, we are talking about the 80%, which is a massive percentage. So we need to remember that when we are thinking about the overall women's health, it's not only protecting them or prevent pathologies, to give them access to the right and the correct treatments, but also to avoid all the situations that are compelling and creating even more vulnerability when talking about women. So probably we have to pay specific attention also to that. And of course, as Valeria was saying, this is something related not only to the Minister of Health, for example, if we think about a national level, but of social policies, of communication, media. So it's really, I would say, a pervasive topic, even if we don't consider that much apart from what we read, what we see at the news, but those are episodes. And then we forget about, the summing up of all the different episodes and the total impact and the total cost of that phenomenon.
Yeah, thank you for adding that to the conversation as well. Something that we should definitely not forget in talking about this topic. Now, I started with asking you to convince me why I should listen to the podcast or to this episode. Now that we are coming towards the end, I want to ask you, whether you're a policymaker or just someone concerned about your health and community, what's one step you would encourage listeners to take?
Inform yourself and engage with people locally, with people who are active on this topic, and really do share your experiences and needs.
Thank you. Do you want to add anything to that?
Yeah, I would say get informed and then spread the word, because maybe someone else cannot get, that kind of information, or doesn't know or doesn't want to. So we have to be all involved. There is no one solution that fits all those problems, but we also know that this is something that we need to resolve all together, or at least being all on the same page. So recognize and giving the right names to the specific issues, and probably unite all the strengths that we have. Also, I'm thinking about all the different NGOs, the associations of patients. We do have a lot of energy, a lot of effort. In some cases, we see a little bit of fragmentation. Also, when we talk about policy making, I'm thinking about political instability, and actually Italy could be also a good example. So we need to focus on one objective. We mentioned many of them. So focus on all these different objectives, have one issue in our mind, but then remember that we are not alone, even if sometimes we feel like we are talking a little bit for ourselves or for the small community that knows about those issues. Because actually it regards everybody of us, not only women, also men and everybody.
Society.
So society overall.
Society overall, and what we also discussed in a previous episode, it's a collective responsibility. That's what we end with. It takes all to make a difference. And I hear you both say, inform yourself. Access to information is not always that easy for everyone, but with this project, we at least try to highlight all the aspects of women's health as much as we can, from the specific diseases that you need to know about, from policy that thankfully you covered in this episode, from the economic aspect, innovation, femtech. We just really wanted to highlight it all so that you can be informed and be your own health advocate. So thank you very much, Valeria. Thank you very much, Irene, for sharing all this information with us. And thank you to our listeners who listen to the Women's Health Uncovered podcast. Don't forget to subscribe to the podcast and definitely let us know what you think after listening to each one of the episodes. Thank you, ladies.
Thank you, Mariam.
Thank
It was a
you,
pleasure.
Mariam.
Thank you, Valeria.
Thanks.